Thanks, everyone. Good afternoon, and I want to thank everybody for joining me. We just finished a very productive dialogue. These are people who have lived the challenge of PBMs really every day for most of their lives, and we have been talking about the quality and the cost of prescription drugs in Illinois, an issue that I've been working on really throughout my time in office as governor. Much of the conversation that we just had centers on the role of pharmacy benefit managers, and frankly, they're a middleman who adds a lot of costs and no real value, and this is a problem. In our work with stakeholders across the medical world, the pharmacists, the doctors, the patients, advocates, PBMs are consistently brought up as an area that needs regulatory reform. There is not enough oversight. And very importantly, transparency and clarity. Multiple investigations, including those from the Federal Trade Commission, and some of you know there's a report out that you should at least glance at. You can find it online, and also a bipartisan group in Congress. They've detailed the direct roles that PBMs play in the rising cost of drugs. So there's a clear need for greater transparency, major reform in the industry. You heard me earlier today in my State of the State address talking about PBMs and unveiling the Prescription Drug Affordability Act, which will rein in unfair practices of PBMs, and I'm going to work with the leaders here, with Dave Kaler in the Senate, with Natalie Manley in the House, to make sure that we get that done. There are no two better people to lead this in the General Assembly, and so I'm frankly very optimistic about our ability to get this done. This is a huge priority for me. I'm ready to hit the ground running on this. You heard me last year talking about the Healthcare Protection Act as a priority. We got that done. We're going to get this done. The PDA Act, it's going to take aim at the common ways that PBMs game the system to profit at the expense of Illinois families and employers. Many of those employers that are really deeply negatively affected are small and medium-sized businesses. So this isn't just about patients, although it is very much about patients, and not just about pharmacies and independent pharmacies, but it is about the small, medium-sized employers out there who end up really paying the price to cover their employees on these bloated drug prices. We're going to shine a light on this opaque business practice that PBMs have, and we're going to give full statutory authority to the Illinois Department of Insurance to examine the books and records of PBMs and require them to submit to annual reporting and to auditing. So this is about reducing drug prices for people across Illinois. It will save people on average hundreds of dollars a year, and for some people literally thousands. And so I look forward to putting my own shoulder to the wheel, working with the General Assembly leaders on the other side of this table, not to mention all across the General Assembly, to make sure that we get it done. And so with that, happy to take any questions.
Governor, when signing the fiscal year 2024 budget, when you signed the FY24
Jeremy,
budget...
you've gotten louder over there. I appreciate that, yeah.
I'll be quick.
No, you're good, you're good. I'm not criticizing.
When signing the fiscal year 2024 budget that placed restrictions on the immigrant health care program, you defended the overall program by saying that you provide coverage to keep people out of emergency rooms and hospitals, and that actually saves taxpayers money.
Yep.
So is eliminating funding to plug a budget hole going to end up costing the state more money in the long run?
So I appreciate you asking that question, and remember that let's start with the fact that I'm in favor of universal health care coverage. So I really do believe that we should be covering everybody. We, unfortunately, as you may know, we expect that the federal government is going to stop reimbursing for any of that cost, and they were reimbursing for some of that cost. And at the same time, we understand that there are many people in this category, the HBIA program, which is different than the HBIS for seniors, program. But the HBIA program, these are people who of working age, they're 42 to 63, and have the ability in many cases, and we've seen it, to get a job that has healthcare associated with it already, and so we have people that were on the program that went off the program as a result of getting a better job. That's not the case for older people that are on the HBIS program. So these are the most vulnerable people. Yes, we're making sacrifices across the budget. I'm making sacrifices on things that matter to me, but specifically, there are young people, children indeed, that we are trying to make sure we're expanding all the time to focus on childcare and preschool. And I would like to get that done as fast as humanly possible. Indeed, there are lots of priorities I'd like to do immediately if we had the resources to do it. We cannot do it this year, and so that's why we had to make some changes.
Governor Pritzker. A few months ago, thanks for the opportunity. A few months ago, Gombe came out with a certain estimate or projection of $3.2 billion deficit, and that's inaccurate. Now, the one you just got is bigger little deficit, and that's good news. How do you reconcile?
I would not call it a little deficit, but
all right. How do you reconcile those two, where they were wrong a few months ago and they're okay now?
Well, you're saying to whatever happened back in November, but remember that's very early in a process that takes us all the way until the end of the fiscal year, or at least until May 31. And so it's very hard to get estimates that really mean something when you're that far away from the end of the year. And you've seen that, it's very important to us to get correct information when you get it in November. By the way, the General Assembly has required us to print that report every year at that particular time. And so we do it because we're required to do it, but it's very early to be projecting the next year, fiscal year that starts the next July and goes to the July after that, not to mention all the other years that you're projecting. And the requirement in that legislation is that we have to project it based on no changes in the way we would spend money or the revenue that might come in. And so we use the estimates that come to us of economic activity in the country, economic growth that comes from the econometric company that we hire, which is S&P, an independent firm. And based upon that, literally put that into a REMI analysis, it's called, that determines, without our input really, what the sales tax would be during that year, the next year, right? And what the income tax from personal income would be, what the income tax from corporations would be. So yeah, I mean, you're saying we dismissed that back in November, but it's not that we dismiss it. We pay very close attention to it. The issue is it's just very early in a year. And so, look, we may get an updated version of this throughout the course of the spring, and we'll have to update the estimates of revenue that will come into the state. That only covered, as you know, $800 to $900 million of the $3.2 billion deficit. It made it a little bit easier, but $2+ billion, 2.3 or 4 billion dollars of what we needed to the gap we needed to cover was a lot of work that we did.
To what extent are the pharmacy benefit managers driving the cost of Medicaid? It used to be that states were constantly suing drug manufacturers over unfair or illegal pricing practices. Has the field now shifted to PBMs? Are they the ones driving the cost now?
Drug price costs, certainly PBMs are one of the major factors, right? And we always talk about pharmaceutical manufacturers too, the originators, and what they charge. But PBMs are literally not adding any value. At least pharmaceutical companies are doing research and they're coming up with new opportunities for us to cure or treat drugs. PBMs are not. They're just adding cost. Originally, they were intended to lower costs, but they've evolved their own industry, and without any regulatory oversight, frankly, patients are getting taken advantage of.
Governor, the budget that was proposed, the proposal today did not address the transit cliff. What does the future of those agencies look like next year if there isn't additional help coming from the state?
Well, I don't think you should assume that there's not any additional help. Here's the challenge. There are a bunch of different levels of government that are involved in making the decisions about what the way is what is the way in which we will address that problem. The Cook County, the city of Chicago, the collar counties, all of whom benefit from a better, stronger transit system, the state of Illinois. We want to make sure that we're not just helping the transit system in the Chicago metropolitan area, but also across the state. And then there will be adjustments to the fare box probably to help fill that gap too. So when you think about all of those pieces, you've got to negotiate in the end. You know, you guys talk about that total transit cliff amount, which could be $750 million or $1 billion, right? That range. Who's covering how much of that is a negotiation that will take place. So it's near impossible for us to put a number in to a budget to make a determination of what the state should be putting forward when we don't yet know. Remember, the General Assembly has said specifically reform should come first, and they're right. So we got to get that piece done, and there's got to be a negotiation that takes place about who's covering how much of that transit cliff.
Governor, how much, if the federal government cuts off the spending as we've seen them threaten, how much would that change your budget? What's the backup plan if there's major changes from Washington?
Are you talking about specifically on one program or just generally?
Generally, federal.
Yeah, you know, we can't, listen, I think you've heard everybody talk about chaos and confusion. It's real. Republican governors in red states are experiencing just like Democratic governors in blue states. You know, that we don't know what they're going to do, right? And you've seen that, you know, Elon Musk comes out with tweets about Social Security that turn out to be completely false, right? That as if they've uncovered something, when in reality they've uncovered that, guess what, the federal government has some old systems written in COBOL, and they've figured out workarounds to deal with the COBOL programming. So, and just dead wrong what he came out with. So we don't know what they're going to do. We don't know whether they're going to cut off the Medicaid expansion across the country. They've been hearing from Republican governors, just like they have from Democratic governors, about the negative impact on the people of their states. So I think it's very hard to build something into our budget to try to determine what the real impacts are. And in the meantime, people should be speaking to their federal representatives in order to make sure that we're not getting you know, this, I mean, really terrible draconian impact on working class people, middle class people, the most vulnerable people in our states.
Governor Pritzker.
You talked a lot about the tyranny of Washington, and Republicans are criticizing you that is you just trying to elevate your political ambitions. What do you say to that?
So they don't, are you saying?
An apology, they said.
Are you saying that my complaints aren't warranted? Is that what you think that they're saying? Because you just have to look at what they're doing here. The tyranny that I'm talking about, and really it wasn't tyranny so much as it was about the challenge to constitutional democracy. When the President of the United States has court rulings against the federal government and chooses to ignore the judiciary, that is a potential constitutional crisis. And that, unfortunately, we've seen happen in the world over many years. It happens that I have had personal experience with many people who saw a constitutional republic destroyed in Germany many years ago because I helped to build a Holocaust museum. I led the building of a Holocaust museum. And I must say that, you know, it's just one example. There have been other examples. But it's the one I think people are probably most familiar with, and I certainly don't mind talking about, you know, when a democracy is destroyed in a very short period of time, you know, that's something that we all should pay attention to when you see the President of the United States ignoring the federal judiciary.
You mentioned Nazis 6 times. You didn't mention Madigan once. Couple of questions.
Yes,
One,
I did.
Not by name.
Not by name. You referenced it. Wasn't in the
I
written
said
speech.
the former speaker.
I
I think
not by
everybody
name.
understands.
2 questions. One,
Yes.
what about ethics in Illinois? 2, how is it not an insult to half the American public who voted for Trump when you're talking about Trump being a Nazi?
Those words never came out of my mouth. That is not true what you just said. Here is what I will say. I think it was important to talk about the destruction of a constitutional republic. I gave my own experience with it, and I think something that's actually unique to Illinois, the most famous case that went to the Supreme Court around an issue like the challenge of Nazis in America or in the world. And so I talked about that. I mean, we had a whole Holocaust museum that was built because of that. I feel very passionately that we always need to be on guard about the future of our democracy. And there was a lot of discussion about it in the 2024 campaign. I never thought that that was something that the voters would pay lots of close attention to, because people don't know what that means when, what does it mean to say that democracy is challenged? There are some people who understand, many people don't. What they do understand is that prices are going up. They do understand that their livelihoods are challenged, and they were promised certain things that are now not being delivered upon, and indeed, they're getting worse because of the policies of the Trump administration. So I was just trying to bring all those things together to address what I think is a gathering storm in this country, and to recognize that what happened in in Europe in the last century is something that could happen really anywhere in the world.
All right. But what do you say to those? What do you say to those who would be insulted?
Are you going to campaign in Bushnell next year?